I'm going to turn things over to Eric Fuchs.
Thank you, Andy. And I still see, at least on my computer screen, that quite a few people are trying to connect to audio. So, like he said, anytime during all this, please put a question in. We'll answer it. We've already got some. Pat Ertz had sent one beforehand. But I want to give just a little background on me, just so you guys know kind of where we come from with emergency management on MRWA. So my background, I was actually an emergency management director for a small county down in southeast Missouri for about 10 years. So got to work a lot with SEMA and FEMA and some disaster declarations. But something else a lot of people don't know is I worked in public health for about 10 years, and believe it or not, spent some time writing pandemic flu plans. So if there's any other questions, I can't say I'm going to be an expert on it, but I have seen a lot of things in regards to flu and outbreaks, stuff like that. So also, we tie in with SEMA, like with Missouri Rural Water. We are actually written straight into the Missouri response plan and what's called an Emergency Support Function 3, which is Public Works. And I want to put out a shout out to DNR, Aaron Schmidt, Todd Eichels. These guys have really helped us out. As you guys saw, we put out a lot of messaging when this thing was hot and heavy, and they helped us with that messaging. They really helped us with their interaction with SEMA, and I know they've been working hard from home as well, but they've done a lot. So as we get going with this, like I said, please ask questions, but we've got 3 or 4 topics, and the first one we wanted to get into is supplies. And that's the one that we had really hit a lot at the beginning. At this point, we don't think we've seen anybody with supply issues. I know there's a lot of little systems that buy chlorine right out, some from the stores, buy bleach. We have heard some bigger systems, some surface water systems having problems getting CO2. I don't know if anybody's had any issues like that. We have heard that in other states. So I just this is a perfect time to constantly reach out to your suppliers, making sure those relationships are there, making sure things are, because I do think this may continue on for a while. I know May 4th, I think we're supposed to get back, slowly get back to normal. We might see a second wave of this. I don't know what's going to happen after that, but make sure you keep those relationships there. Make sure you call, make sure you keep plenty on hand. PPE, believe it or not, we have heard no request for personal protection equipment, for masks, things like that. I see Pat's got his glasses on right now, so he's got his PPE in. But we've not heard anything. But if you guys want something like that, you think you need it, please let us know. We can help you with that. We can help you source it, get it sent to you, or however we want to do. But at this time, I know a lot of our little systems use a lot of social distancing as it is. So just keep that up. I'm going to go ahead and answer a question because it kind of goes on to this. Pat Ertz sent in a question. I'm going to read it here. He wanted to know about like systems getting back to normal with the offices and everything, and something he put on testing and how that would happen. So again, a lot of this is from my opinion on what I've seen from the public health standpoint. Testing is probably, I don't know if that's going to happen. I don't know if there's going to be a lot more tests come down the pipe. As of right now, it's not looked like it has been. So if I ran a water system or was a clerk at a system, I would look at to some of the stores, how they open back up. I would look at the social distancing. I know I've been to a lot of different stores that have X's marked out where people say, so far apart. They only allow so many people in the office or the store at a time. Of course, do your drive-in as much as you can. But I don't know that testing is going to be part of that equation. And even if it is, it's a constant changing thing. If you test somebody and they test negative, then they go somewhere the next day or two, then are you going to have to test them again? It's just probably going to be a lot of continuing on with the social distancing and try to work around those things the best you can. So just keep us in touch with that. Like I said, with the public health connections, I think I can probably get you more information on that as needed, but we're probably going to hear more about that in the future when they slowly start opening things back up. So another one that I think is really, you guys all saw the surveys that come out from National Rural Water. I think May 1st is going to be interesting in regards to disconnects, shutting people off. We saw quite a bit of it on April 1st. I got quite a few calls on I see Mike Johnson over there on calls on executive orders saying we shut off. As of now, there is no executive order. There's nothing that says you cannot shut people off. But with that said, there's a lot of systems I know that are trying to use their judgment from a PR standpoint. I know a few people have tried to shut folks off, and it's been a public relations nightmare. Clark County comes to mind. They actually just said they're not going to shut anybody off right now because they figure they gain more from the public relations than they would on anything. I'd like to tell you just, first of all, it probably would not be a bad idea to get policy in place. Most of the examples we've seen on shutoffs were people that hadn't paid their bill for a long time anyhow. Policy, good judgment. Think about the PR. You're probably going to get burned up on Facebook if you shut an old lady off that hadn't paid her bill for 6 months. So I just would like to, I can't tell you what that is, but I would get that policy out. But as of now, you're within your legal authority to shut off as many as you want to or when you want to. So, Andy, are there any questions on this right now?
I just got, in Diamond, we're still shutting off and getting grief. That's from Jessica Sarton. And if anyone has comments, feel free to send us a chat, a text through the chat box, and then we can go back and unmute your microphone so you can actually have a voice too.
So with that question, you're going to get grief, and that's what I'm talking about with the PR standpoint. Even if somebody hadn't paid for a long time, you're not probably going to hear that part of it on Facebook. So, but just use good judgments on that. But honestly, I have to use Mike Johnson as an example. They thought they couldn't shut anyone off, and they saw their income drop. They were thinking they were going to have to lay people off. I mean, that is a concern. So you guys have to keep the lights on and the chemical bills paid. So that needs to be a concern. But there also is the public relations standpoint that is part of it as well. So, okay, well, I'm going to continue on here a little bit. That was with the disconnect. I think there'll be some questions on this, but finance. So I don't usually think we talk about finance stuff when we're talking about emergency management. But again, I think May 1st is really going to be the make break of when people decide not to pay. I know a lot of people, I've seen a lot where they have lost income, where factories have closed down, plants have closed down, restaurants closed down, may have picked up a little bit because everybody's at home. But one important thing, there's usually in emergencies, there is a declaration like there has been both on the federal and state level, and so most everything is run through FEMA. But this has been a little different. There has been monies that have come granted directly to the state. We don't know how that's going to come down at this time. There's been at least 2 packages from the feds. They're looking like another package. A lot of what I'm getting ready to say is going to be my opinion based off what I've seen in the past and what I see happening right now. But first of all, what I think is paramount for you guys is I want to make sure you keep everything separate in regards to accounting purposes. Every hour, the electric, every PR thing you do, every shutoff you do, or lost income that you have, make sure that is labeled somehow COVID-19 or somehow put it separate as COVID-19, because that is the main thing on any kind of declaration, be it FEMA or anything else, is to have that paperwork in order so you can actually show or justify how much money you have spent on this. So most time water systems themselves do not, some do, but a lot of times you can go with the county too as well with your declaration. So most all counties, especially the small ones, will probably have somebody in their county clerk office that's already compiling things from the different agencies in the county that will help with that declaration. So most of the time anybody that's ever worked with disasters knows the FEMA money is more of a long-term thing. So, but do keep everything separate. So short term, we have had some people that we've heard applied for the PPP. I'm going to tell you that if you read the rules of the PPP, it is probably, and there was a water system that got the money. So with that said, if you read the rules of that, they are probably not qualified for that. And I think this last round that they're getting ready to sign today, there's a lot more information or frequently asked questions, things that they put out there to show whether that's can be used for that or not.
Could you quickly define the PPP for those that might
I'm
not
sorry.
know?
That's the payroll protection plan. That is through small SBA, Small Business Administration, that helps people continue to keep folks employed and allows them to make a loan so much of their payroll, rent, utilities, and then after I think the 2.5 or 3 month point, that is supposed to be forgiven as a grant. So with that said, we really, I don't think as a district or a municipality don't qualify for that. As far as a, like Alliance or some of those, I really can't, I see Bart's on here now, but I really can't answer that with that. But from a water system, not for profit, I don't think we qualify for that. So I would hate to see somebody get the money, spend it on something, and found out 3 months later, because I think you guys have seen on the news, they're starting to require a lot of people to actually pay it back. So be very careful with that. With that said, I do think the next round is going to be some money coming down from the feds. It's probably going to be directly paid to municipalities. It's anybody's guess how that's going to come. National Rural Water did do a survey that you guys probably all saw. I don't have the numbers here in front of me, but the biggest concerns or the biggest issues with that was not PPE, was not chemicals, but it was lost revenue. And we would love to hear from some of you guys just personally on what you've experienced with that. I mean, I know I've seen some big ethanol plants close down. I know they're big users of water. Tracker out in Lebanon closed. So I know there's a lot of places that closed. So I would be curious to hear from you guys. When we were sending out all those email updates, we heard some stuff back, but we really would like to hear from you guys anything on like Pat's opening back up, or any questions, so we can kind of reach out to all the membership on what those questions might be out there. But with that, I do think there's going to be something come down for municipalities and for districts, but I have no idea what it's going to be. I don't know if it's going to be direct grants, low interest loans, forgiveness. At this time, we really don't know. So Andy, any questions on those?
Yeah.
You guys are awful quiet. I want to hear the questions. So, talked about the future funding, the tracking the COVID-19. So really the last thing I've got here, it's maybe a quick thing here with no questions, but the emergency operators list. So I see Mike shaking his hand here.
Eric, can you hear me now?
I can.
Okay, so I got a question. I want to go back to the shut-off, on the shut-offs. I've had some complaints. I mean, you worked on both ends of the deal. If something happens when we turn the water off and it gets to be sanitary purposes, can they go back and call the health center and they come back on the city again?
Well,
being under emergency.
And that's where I got to say, you really got to use good judgment on this, because it's hard for you to really have a leg to stand on. But if you do, or if it's somebody that hasn't paid their bill for 6 or 7 months, I mean, I don't think this is a good reason for them all of a sudden not shut them off. But are you willing to put up with that PR nightmare? You still have the authority, whether public health or not, because there's not been any executive order. But how much are you willing to put up from a PR standpoint is what it comes down to. So I know I didn't answer your question really, but I think you get where I'm coming from there, because I've seen I've already had some counties and cops got called out, Facebook posts, everybody got burned up, and the fact is they hadn't paid their bill for 3 or 4 months. But they're going to play that public health card and everything else. But again, so it may be a time, but again, if you don't shut them off, you can still have late fees, you can still have fees that are accruing. We don't want to be ridiculous. I mean, I always use the example, if somebody has paid their bill religiously for 10 years and all of a sudden now they're without a job and can't pay, well, then we need to take that in consideration. But at the same time, there's unemployment out there, and you guys have to be able to still pay your bills. So
We have a question coming from Pat Ertz.
Okay, Pat.
Pat, I've unmuted you so you can speak, sir.
Okay, thank you. Thanks for doing this too, Eric.
You're
I was
welcome.
just curious about, have you heard anything about the liability of a water district? If you open up your lobby, that's what I was getting to, the testing, without knowing if anybody here has had COVID ID or or maybe they're immune to it. We're seeing that some of the nursing homes, they're already, going to be a lot of lawsuits against them now for not following, for not testing enough people or for knowing what's going on. That's why I was curious if the state was going to have any funding for, or to at least make sure we have the ability to get our employees tested before we would open up.
Boy, Pat, I'm going to say I do not know on that, but I sure don't mind poking around and finding out. My thoughts are any testing that comes out, of course, first is going to go to everything medical type, first responders, what's deemed essential. But at the same time, that's a very good question. I don't have an answer, but let me poke around and see if I can find something. If we get everybody's email, I'll put it back out to the group, or we'll just put it out as an e-news update to everybody. But that's a good question. So don't have an answer right now, but I'll find you one. Okay. Is there any other on the chat?
Nothing else on the chat right now.
Okay. So any more questions? I know that's a pretty hot topic on the shutoff. Any other questions or any other examples that people are doing that we think we or might want to let us know that we can pass on to the rest of our membership? Okay, I'm gonna head on to the emergency operators list. That's one of those things that we haven't had many people ask about, but it seems like we had a lot of interest in, especially when it comes to DNR and EPA and stuff like that. So just to explain that in a nutshell, we put that out to see if we can, and this may be something that we continue on after the fact. It seemed like a pretty good deal of how can we get something to help these little systems out, because how many of our systems is a one-man show, and if it's a two-man show, the mayor is the other one. So we put this list together. It's not a list that we're going to put out or make public or anything else, but we've tried to kind of compile it from a geographic standpoint around the state. We're part of that list as far as we're concerned. But there may be some concern when you guys do open back up that people start getting some stuff, and now we're sick, because the biggest problem with it, as you guys know, and from the public health standpoint, is the quarantine thing. So if you got two operators working together, one gets sick, the other is going to have to be quarantined for 14 days. So probably can't quarantine them at the water plant. So with this emergency operator list, I would like to give you guys something that I think we're going to see in the future and that would really help with this. And it's a fancy word you hear called a COOP plan, C-O-O-P, and it's continuity of operations. And I heard an example the other day where somebody wrote up how their plant or how their system, whatever, would work, and then they actually brought in one of the grandsons of the operators and said, okay, read this and go operate this plant. And he had no background in anything. So with that said, I think it would be a good idea for these systems to maybe jot down a few things that says, hey, here's how you have to set this, or all those little things that only the guy that operates it knows. So if somebody does have to come in, or we have to come in, that they know that you have to throw this switch and hold your hand just a certain way while you're standing on one leg to make that system work, because we know we all have those certain things out there. Right, Bart? I see you laughing. So with that said, these plans, they don't have to be fancy. They don't have to be some kind of great format, but we'd be glad to help you with that. But a continuity of operations plans, a lot of people have pulled those off the shelves because they have left and they're working out of the house, and they don't, it's been a learning curve. So just looking at that, Andy, I see you.
Yes, we had a question from Anthony, but that come in a little bit later. He had a question about shutoffs and what might be the consensus on commercial shutoffs.
Okay. Yeah, I think the same would apply for commercial. If these guys, and you have to look at that as income in the community as well. If this, it's not just income for the water and wastewater, it's also income for the town itself. So, boy, I think I would, again, from a PR standpoint, if keeping them on opens a restaurant or gets something going again that's going to put more tax base in that town. I know this is one of those things that you have to think on your feet with, but man, you really have to look at that. At what's the greater good is what I look at here. What's the greater good for everyone involved? And if it was me from a commercial standpoint, if they're payers that they've always done, man, I'd sure look at doing what you could do to make sure that business gets back open. So Hope that answers that question. So, but going on a little bit more with the emergency operators list, that would really help if that did. And we had quite a few calls on that nothing happened, but somebody down the road had gotten diagnosed and they were worried about it, and the mayor was old. And so with that said, if there's anybody, number one, that wants to be on that list, and or number two, if you think somebody could use that, I think it would really come in handy in some of these things, because we're reading quite a bit about a second wave, and from a public health standpoint, that could happen. We haven't seen a lot of bad things come from this as far as infection rates or whatever. A lot of little communities still don't have anything, but when we start slowly opening back up, we might see more. I don't know what we're going to see, but I think it's something to be ready for. So, any questions on the emergency operator list? Any other questions, Andy?
I was kind of curious with the folks that have joined us this morning. Is there anything that we are not mentioning that might be important that we could share with the entire group and share with membership, for that matter, that are issues that you're coming across that people might be overlooking? If that's the case, feel free to hit the raise your hand button down below, or send in a quick chat in the chat box, and we'll unmute your mic, and we'd love to hear that stuff.
Yeah, because there's lots of things. I mean, we've got the circuit riders. A lot of us are out in the field somewhat, nothing like we were. But that's why, like when we came up with the PPP thing with PPE thing. Sorry, too many P's here. With masks and things like that, we really hadn't seen a need that people wanted. So not that we can't help them with that, but there's a lot of things that if we're not out in the field or not right there with you guys, we don't know about. So. And also, if there's any great things that people have found out with bill pay, or things they've learned, or things they've learned in Zoom meetings like us, let us know. But Andy, we get a question?
We do. Pat, I'm going to go ahead and unmute you again. Pat Ertz.
Yeah, the only thing that's been a little difficult here is the compiling our CCR for the year. We bill every other month, so we need to get it done to put it out in May and June to meet the July 1st deadline. Just getting results together. I think the state of Missouri is working really hard down at DNR, but I think everybody's working from home and everything seems to be dragging along. I haven't heard that there's going to be any, changes in the rules, but just curious if anybody else is having any difficulty.
Well, and if that's something, does that need to be put off? You think that? I mean, I didn't think about that. That could actually be pretty big for a lot of people. I know they've put off some with the hours that's needed, things like that. I don't know, maybe it's something we need to kick around and see if that's needed. CCR, yeah, we'll write that down. Thanks, Pat. We appreciate that. Anything else? Awful quiet crowd here.
Watch what you wish for. Got two more questions.
Okay, we got a couple questions.
Anthony Buck, that joined a little bit later, had asked, have you covered the consensus on systems splitting up operators during the day?
No, we haven't, and that's a very good thing. I think, if you have the ability to do that based off the social distancing and stuff, I don't think that's a bad idea. If there's any way you can follow the social distancing laws, unfortunately, a lot don't have the ability to do that with the operators they have. I don't think it's a bad idea. Like I said, a lot of you guys are social distance as it is out in the systems, but if you have the ability to do that or go to shifts how you are, or the ability to not go in at all, I don't think that's a bad idea, is our opinion on that. So it'd be a case-by-case basis, but thanks for letting us know that, because I think you're the first we've heard that we're doing that. We've heard a few talk about it, but so I don't know if there was a question there that I may have missed, but I think bottom line, I think it's a good idea.
Got another question from Tammy Winter.
Okay.
Can they use the one on DNR's website and post it on their bills? And I'm going to assume that's on the CCR.
On the CCR, yeah. So repeat that again, so everybody, what her suggestion was.
Tammy Winter had asked if system could use the CCR that DNR posts on their website and just tack that onto their bills.
Okay.
So folks have access to the CCR.
Yeah, and we'll follow up on all that. So that's a good question, and we'll get you an answer on all that. Trying to think. Like I said, I think we'd really like to hear back from you on, and I keep going to this May 1st date. I think that's going to be pretty important when it comes to bill time. I think when we did talk to National Rural Water when they did that survey, some of the feedback we got was, hey, it's a little early to figure out what's going on, but we'd really like to hear any individual thoughts on finances, how much it's gone down, how you guys are handling it, what your plan is. But I can't say enough about keeping good records on this. Keep it in a separate way to where it's marked somehow COVID-19. Got another question, I think.
I got a comment from Bart Downing with Alliance referencing the splitting up operators during the day. It looks that Bart, they are doing that, and they're also keeping their distribution folks and their operators separate if at all possible.
Good idea. That's a good idea. Yeah. Anything you could do with that, because if you have 2 or 3, like I said, because the problem is we are seeing a lot of people that may get, I say a lot of people, we're seeing instances of people are getting this that are not very sick or may not get sick. But if I know this from my public health days and the way the investigation is going to be done, if you get tested positive and you have had direct contact with somebody else, they will be quarantined for 14 days. That's what's going to happen. At least it's supposed to happen that way. Yeah. Can I say that?
Yeah, I'm
Okay.
going to go ahead and interject there.
Yeah.
Personal experience on my end. I live in central Missouri here, right across from the MRWA office, but I have grown children that live in southeast Missouri. My daughter lives in southeast Missouri. She worked at Poplar Bluff Regional Medical Center, and she didn't feel good on a Sunday, went in, got tested on a Monday. She was found to be positive, and she got quarantined on a Tuesday. So she is, along with her roommates, is quarantined for 2 weeks. She is rolling up on her second week and about to go crazy because she's quarantined, but it is what it is.
And I have to add to that, she was very good shape. She had very few symptoms. Everything was good with her, so wasn't crazy sick. So she's doing well. But anyhow, if you have any other questions like that from the health department standpoint on how this works, how the investigations do, what will happen, I will tell you that I do keep in touch with all these health departments, and this testing thing has been, I won't say it's been a nightmare, but there's tests out there, always have been, but there's been a lot of criteria on whether you get tested or not. And now we're starting to see more and more about rapid test, whether you're going to do a quick test. So I just truly don't know or see where that's going to go in the next 2 or 3 weeks. But we're seeing instances of like Cole County actually is opening back up on the 24th when the governor says the state's not going to open back up to the 4th. So it is really a county issue. It's really your issue, your essential services. What you want to do is really up to you. I think there's a question came in, Andy. Did I see one?
Looks like there's a couple comments. I think Anthony had asked again about the funds available for publicly owned utilities receiving funds for loss of revenues, the PPP.
Yeah.
And also, Tina Good had interjected that they are not shutting off water now, but the clerk in Albany had shared a good letter that could be altered to send out to delinquent customers.
Absolutely. I tell you what, we'll reach out to Anthony. We had talked all about the funding stuff. If we want to talk afterwards, I can go over that again with you. And Tina, we might look at one of those letters to send out and see if somebody wants to use an example, if you don't mind. So that's the kind of stuff we're looking at, And I'll assure you, if things get hot again, we will start those daily or every other day e-news updates. I hope those were all right for you guys. We got quite a bit of good feedback. Okay, good. Thanks, Bart. Got another Anthony. Thank you too. We got a lot of good feedback. Unfortunately, people don't say a lot sometimes, but we will continue to get those out. And if there's anything, we got a thumbs up. But look at there, Mike Johnson learned how to use a thumbs up. If there's any other things that you can help us with, we want to know, because you guys are kind of the we talk to 40, but we've got 1,000 we need to reach out to. So we love to use examples from anybody else. And if there's anything from state emergency management that we need to pass on, don't forget flood season's coming up and tornado season's coming up. God forbid anything happens during this, but I would say just stay vigilant out there. And if there's nothing else, Andy, any more questions come in?
Would we have anybody else wanting to share some knowledge before we call it quits on today's drop-in?
Well, I tell you what, I hope we've helped you guys out. If something comes up again, we'll continue on. Mike Johnson's got a question.
I got one more question there. Appreciate it, man.
All right. No.
Say, is anything is going to change as far as the couriers and sampling? That's all going to stay the same as far as you've heard?
Everything I've heard, that is all staying the same, you know, and I guess I've heard that they kept up fine when it was hot and heavy and no problems. And yeah, so the only things I've heard that some of the health departments or some of the drop-off places had you drop them off outside, would not let you go in. I know most all health departments are doing, you know, temperature checks, things like that to come in. Which brings in another thing, Pat, that made me think about. You may put in some requirements like for your employees to take their temperatures each morning before they come in. Your local health departments, I know they've been a little busy, but they would be a really good place to start if you do have questions and saying, hey, I'm going to open up, what's the best way to do? I can reach out to the state health department as well. But to answer two questions though, Mike, everything has continued the same except maybe how you dropped it off or the way you got it taken from that standpoint, but that all should still stay the same. Okay, well, anything else, Andy?
Nothing I can see to just, I think the only health department that I'd heard about kind of taking themselves out of the courier thing, and I don't know if they've reinstated themselves, but was Caldwell County.
Yeah, I think, okay, well, listen, folks, we appreciate you guys. We really do. You guys are the one that keep it going out there. I mean, the reason it's been so quiet is because of you guys. You know, there's not been any interruptions in water. There's not been any interruption in wastewater. We have seen a little bit of raising its head about this virus being able to be in wastewater and testing and stuff like that. I don't think anything's going to come of that. But with that said, we appreciate you guys, each and all of you. It's been weird for us trying to figure out what we're going to do. We're all back on the roads now. So thanks to each of you. And please reach out to us personally if you need to. If not, we're going to sign off.
Hold on 2 seconds.
Hold on
there,
2
Eric.
seconds. Hold on.
I'm gonna include Eric's phone number for one
Yes.
of our participants. He wanted to speak after the fact on some of the funding questions.
Yeah.
I was also going to say, this is our first drop-in. It's kind of like a cross between a podcast, an open forum, and a webinar all in one. So if you guys enjoyed this and thought it was worth your time, let us know. Contact us online if you would, and just shoot us a quick message to say, hey, we thought that was helpful, and we'd like to see those in the future.
Mike, do you have another question?
I got one quick question on the way out.
No, please, no.
I got Dwayne here with me. He wants to open turkeys and gobble if he can handle their true place.
If they're gobbling, I'd not hurt them.
I wanted a copy of your work schedule if they was.
Hey guys, thanks for keeping it light, man. We enjoy you all. Glad you're helping out. Keep safe. Be safe. Hope you don't get the corona. Wayne County's still corona free, so that's where I live. See y'all. Y'all take care.
Thanks again for dropping in.
Thank you.